Audio Jungle.
This is High-Tech News TV News. Chennai Prashanth Hospitals proudly announced a groundbreaking healthcare milestone led by Dr. Parimuthukumar, Clinical Lead Institute of Robotic Surgeries, Prashanth Hospitals. With 100 successful Indigenous robotic abdominal surgeries completed, the first surgeon in Chennai to reach this milestone. Dr. Parimuthukumar is setting new standards in surgical precision and patient care across Tamil Nadu. Amongst his achievements, he is also the first doctor to perform the country's first inter-hospital robotic telesurgery covering a distance of 340 kilometers. The milestone celebration featured a special felicitation by Dr. Vishwa Srivastava, CEO, APAC SSi Mantra, India's leading surgical robotic company. Dr. Vishwa honored Dr. Parimuthukumar for his clinical excellence and leadership in achieving the 100 Indigenous robotic abdominal surgeries landmark and also acknowledged Dr. Parimuthukumar pioneering a role in performing India's first inter-hospital robotic telesurgery. After that, Dr. V. Selvaraja, founder and managing director of Dharan Hospital, said, Parimuthukumar's achievement is not just a personal milestone, but a transformative moment for surgical care in Tamil Nadu. Completing 100 robotic abdominal surgeries and pioneering inter-hospital telesurgery highlights the power of technology to bridge healthcare gaps between the urban and rural regions. At Dharan Hospital, we are proud to be associated with such path-breaking advancement that redefine precision, safety and accessibility in patient care. About the Prashanth Hospitals, Prashanth Hospital is a multidisciplinary hospital that provides sophisticated and dedicated healthcare services by professionally trained experts. Prashanth Super Speciality Hospital at Velachery and Kolattur is one of the best and well-known multi-speciality hospitals in Chennai.
Prashanth Hospitals Dr. Parimuthukumar தலைமையில் 100 robotic surgery, abdominal surgery, SSi Mantra பண்ணியிருக்கோம். இதை ஷேர் பண்ணுறதுக்கு எங்களுக்கு ரொம்ப மகிழ்ச்சி. இதில் பார்த்தீங்கன்னா காம்ப்ளெக்ஸ் சர்ஜரிஸ், gallbladder removal, hernia surgery, uterus removal, colon cancer surgery, spleen removal எல்லாமே பண்ணியிருக்கோம். இதோட பெனிஃபிட் பார்த்தீங்கன்னா பேஷண்ட்ஸ் வந்துட்டு சீக்கிரம் வீட்டுக்கு போகலாம், வலி கம்மி, பிளட் லாஸ் கம்மி. இதுக்கு வந்துட்டு ப்ரூஃபாக வந்துட்டு நிறைய பேஷண்ட்ஸ் இன்னைக்கு வந்திருக்காங்க, பேசும் செஞ்சுருக்காங்க. ஸோ இந்த ஹாப்பி நியூஸை செலிப்ரேட் பண்ணுறதுக்காக தான் இன்னைக்கு வந்து நம்ம இங்கே இருக்கோம்.
ரோபோட்டிக் சர்ஜரின்னு பார்த்தீங்கன்னா ரோபோட்டிக் சர்ஜரி தான் ஃபியூச்சர். ஸோ ரோபோட்டிக் சர்ஜரி அறுவை சிகிச்சைக்கும் ஓப்பன் அறுவை சிகிச்சைக்கும் உள்ள வித்தியாசம் என்னன்னு நமக்கு வந்து பேஷண்டே ஒருத்தர் சொன்னார். அவர் உடம்புல பண்ண ஆப்ரேஷன் ஓப்பன் சர்ஜரி அவர் பண்ணிட்டாரு, அப்புறம் அவர் ரோபோல பண்ணிட்டாரு, என்ன வித்தியாசம் சொன்னாரு. ஸோ இது வந்து எல்லா எளிய மக்களுக்கும் தெரிய போகும். மெயினா என்ன நாங்கள் சொல்ல விரும்புறோம் அப்படின்னா, ரோபோட்டிக் சர்ஜரினா ஃபர்ஸ்ட் ஒரு மக்கள்கிட்ட ஒரு பயம் இருக்கு. ஸோ அந்த பயம் தேவையில்லை. ஏன்னா எல்லா டெஸ்டிமோனியும் மட்டும் இந்த SSi ரோபோங்கிறது இந்தியன் மேட் ரோபோ. கிட்டத்தட்ட 6000 சர்ஜரிக்கு மேல பண்ணிருக்குது இந்த ரோபோல. நம்மளே 100 சர்ஜரிக்கு மேல பண்ணிருக்கோம். பேஷண்ட்ஸ் எல்லாருமே சேஃபா தான் இருக்காங்க. இது சேஃபா இருக்குங்கிறது தெரிஞ்சதுக்கு அப்புறம் தான் நம்ம மக்களுக்கு சொல்றோம். ஸோ ரோபோட்டிக் சர்ஜரி அப்படின்னா மக்கள் ஃபர்ஸ்ட் பயப்பட தேவை கிடையாது. யாருக்கு தேவைங்கிறத டாக்டர் பார்த்துட்டு சொல்லுவாங்க ரோபோட்டிக் சர்ஜரி பண்ண முடியுமான்னு. அந்த மக்கள் அது சேஃப்ங்கிறத தெரிஞ்சுக்கிட்டு அவங்க தைரியமா வந்து ரோபோட்டிக் சர்ஜரி பண்ணிக்கலாம். ஸோ ரோபோட்டிக் சர்ஜரி சேஃப் அப்படிங்கிறத மக்களுக்கு போய் சேரணும். அதுதான் மெயினா இந்த ஈவெண்டோட விஷயம்.
It was very important for us to be the path for other innovations in the country. You see, India, there's no shortage of brilliant people. It's just the opportunity, to rise and to innovate was oftentimes limited. I gave a talk earlier how 4 lakh rupees can change an entire country, and the 4 lakh rupees was the charge for this one patient. That was the spark that drove the fire that led us to innovate and develop the system within the country without copying any other technologies outside of India. We really wanted to be original. We wanted to be true innovators, and it was very important for us to also keep in mind how to remain cost effective. Us as a company, beyond the development of the surgical robotic system, which, as you know, takes a lot of capital and financial resources, engineering requirements, recruitment of people. So we slowly built over time. There's been a lot of progress that's occurred in the last 10 years. And I think where we are now today, we're very proud to say that we have a very stable robotic platform. And now our next goal is how we can offer our SSi instrumentation costs within 10 to 15% of traditional laparoscopic charges on average. So that now surgeons can easily then convert their laparoscopic or more traditional patients to robotic surgery. As was said previously, robotics is the future. and we're only playing our part to not only get it into the hands of the surgeons, but get the most number of patients to be able to benefit, because it's such a wonderful technology. If you look at, and I think it was described earlier, that the actual true cost of robotic surgery, yes, it might be at least initially a little bit higher in the beginning, but compared to traditional methods, is actually, the open surgeries are actually much more expensive in the recovery stage, and not being able to go back to work, and for many of these patients, who are the breadwinners of their families, they have to get back to work, quickly. They don't have the luxury to, sit and recover. And us as SS Innovations, we are also trying to do our part from a government and policy point of view, meeting with the ministers. Recently, we met with our nation's health minister, Sri JP Nadda, the other day, and having discussions on how, patients, can get robotic surgery covered in Ayushman scheme. How we can introduce robotic surgery training as part of the postgraduate curriculum in medical colleges, both in the central and government and state government level. India has the highest number of medical colleges globally. So India has a huge opportunity if we can now introduce a cost-effective system, and that you can train the next generation of robotic surgeons, and India can actually become an export center. Not only training robotic surgeons, but also increasing in the medical tourism, because now India is already doing it. So now why not elevate, to the next level of care? Today it is robotic surgery. Tomorrow it might be something. SSi Mantra is in 10 other countries globally. Yeah, everything is tied as per the regulatory approval. So just to give you an idea of what's going to happen in the remainder of this year, early half of next year. So we do have our US FDA and European CE mark ongoing. Currently, we have approvals in Nepal, Sri Lanka, Indonesia, Philippines, Ecuador, Colombia, Ukraine, and I think Australia will be coming up soon, hopefully. So as we get CE marked, then many other countries will then open up globally. But see, we really wanted to, being an Indian company, we have to start in India. Two, also India being a very price-sensitive market towards healthcare, it was very good for us to analyze in this area here within India, because then once we had done more than 500 cases, we started, successfully. We had started getting calls from other countries, because although India, it's a very price-sensitive market, but it's not the only price-sensitive market. I was getting calls from Southeast Asia, from South America, from parts of Africa, parts of Eastern Europe as well, Western Europe. So patients, they're not seeing the benefit or having access. There's the same issues. In the United States, for example, there's only 35% penetration. Why? Because it's only in the metro cities and university hospitals. Patients still have to travel. So this problem is universal. I think that we're able to show that a working model can be achieved within India. Then we can extrapolate that experiences with minor differences to other parts of the world. R&D. Yes, we're always in R&D. We want to be a science-based company, and even when wonderful surgeons who I'm, surrounded next to, they might have ideas, have comments. They come to us, we'll work together, make new instrumentation, to come up with ideas. We always tell everyone, you should, if you can think it, you should do it. Because if you don't do it, someone else will.